safe.
In health news, the increased risk for pregnant women diagnosed with COVID-19 and a warning from the Food and Drug Administration to pregnant women about pain relievers. Dr. Ronika Chowdhury, an OBGYN with Hartford Healthcare St. Vincent's Medical Center, here to explain more. Doctor, first, thank you so much for being with us. Really appreciate it.
My pleasure.
Let's start with this study first, released by the Centers for Disease Control and Prevention, pointing to more evidence that pregnant women with coronavirus are at an increased risk of complications. Certainly not what people want to be hearing.
No. As you know, the data keeps unfolding slowly. And so a recent study was released, and the CDC guidelines recommend that pregnant women should be more careful than ever. We've been very careful with our pregnant patients already, but now we know that pregnant women who have COVID have an increased risk for complications, severe illness that, when compared to non-pregnant women, can land them in ICU or have a higher risk for increased mechanical ventilation. And we know that there's no increased risk that we see in mortality or death, but they can get much more severely ill. And then if you're a pregnant woman who has risk factors such as obesity or gestational diabetes, your risk for getting severely ill are even higher than the non-pregnant woman who has obesity and diabetes. So really a great time to be very proactive in health and planning pregnancy at your healthiest moments.
Boy, that's scary to hear. And of course, we just worry about the baby when we're pregnant, right? So what kind of impact does this have on the fetus or babies when they're born?
So there's really no clear data that represents or says that a fetus is at higher risk of what we call vertical transmission from mom to the baby in utero. We worry about moms who deliver who are COVID positive, and how do we handle the baby after birth, because we don't presume that the baby is going to be COVID positive. So if a mom has COVID-19 or is a person under investigation, or we don't know her status, then we treat her much more carefully. We teach her how to mask, do social distancing, and just be careful in our handling of the baby.
And what is the recommendation to reduce their risk?
For the baby's risk. So if the mom is COVID-19 positive, we're recommending the mom, when she's handling the baby, we're encouraging breastfeeding. That bond is really important in the beginning. So moms are taught to wear their mask, do proper hand washing, and then as much as possible, have maybe the baby when they're in the hospital in an isolette so that they're minimizing their risks. So they need a lot of support so that they can have people who can take the baby when the mom's not immediately feeding or handling the baby. So just minimizing risk.
Okay, and the last thing we want to hear is our medications are making things worse. But there is a warning about some over-the-counter medications leading to complications in pregnant women?
Yes, absolutely. So the FDA just released guidelines on non-steroidal anti-inflammatories, which in layman's terms are things like Motrin, Advil, Celebrex. Those medications have always been used judiciously in pregnancy. We know that after 30 weeks they can affect a fetal heart, but the FDA now has released guidelines that moms and prescribing doctors should be aware that there's risk even after 20 weeks of pregnancy, and that those medications are linked to fetal kidney damage, which can lead to decreased amniotic fluid because the kidneys are starting to make urine at that point for the baby, and that is what creates the amniotic fluid that is the cushion around the baby and for safety. So really to be careful. Baby aspirin, which we use for other reasons in pregnancy, is still considered relatively safe. But if you have a fever, if you have a cough, if you're not feeling well or have aches and pains, don't just take it upon yourself to take the Motrin or the Advil. Make sure that you talk to your doctor. There's always a risk-benefit analysis, so make sure your doctors are aware of the medications you take. And if we can, we're definitely trying to avoid after 20 weeks of pregnancy those medications now.
Okay, and is there anywhere expectant moms can go to get more information on this?
Yes, so the CDC website is a great source of information, and I think that at this point I would still recommend that moms and providers look to that for guidance.
All right, Dr. Chowdhury, I want to thank you so much for your time today. Very good, thank you.
Thank you for having me.